I'm Dr. Peter McCullough. I'm a practicing internist and cardiologist and academic epidemiologist. I hold degrees from Baylor University, the University of Texas Southwestern Medical Center in Dallas, the University of Michigan, and Southern Methodist University. I've been a leader in the pandemic response since the outset of the crisis. I've worked diligently with my scholarship as well as my clinical acumen to develop methods of treating COVID-19 early to help patients prevent hospitalizations and deaths, to give a fair assessment and then warning about the dangers of COVID-19 vaccination. And finally, I've published the first peer-reviewed detoxification protocol to help patients get through the sustained injuries that they have developed from COVID-19 mass vaccination. What's on trial at this point in time in Brazil are civil liberties. What came through the pandemic was a sweeping change in terms of groupthink, authoritarian groupthink that stripped freedom of speech. Very importantly, it stripped academic dialogue, which we needed greatly at the time of the crisis. We needed to exchange ideas. We needed to be open to new methods. We needed to prioritize human life that was at risk with the viral infection and now with COVID-19 mass vaccination. We've learned, unfortunately, that the vaccines were neither safe nor effective. There are over 3,400 peer-reviewed papers demonstrating the COVID-19s are not safe. They cause damage in 4 major domains: cardiovascular, neurologic, hematologic, and immunologic. It's possible that accumulating COVID-19 vaccine material, messenger RNA, adenoviral DNA, and the spike protein may be oncogenic. It's certainly possible that contaminants within the vaccine make it worse. That is what's called plasmid cDNA. And together, the combination of a variety of factors have fulfilled the multi-hit hypothesis. And indeed, COVID-19 vaccination may be fundamentally changing the risk for cancer over the next several years. Bad data and bad news have come in from all over the world. Rates of fertility are down. We have 2 studies demonstrating reductions in male fertility with COVID-19 vaccination. Maternal and fetal outcomes are nothing short of horrific. We know now that COVID-19 vaccination during pregnancy and during the breastfeeding period results in premature labor, miscarriage in the first trimester, stillbirth beyond 20 weeks, and then both maternal and fetal loss at the time of delivery and beyond. In the United States, we now have a record maternal mortality since the COVID-19 vaccines have been rolled out, and we have now the first upturn in infant mortality, again associated with mass, indiscriminate, ill-advised, unsafe genetic vaccination. So I'm calling on Brazilian authorities to drop all mandates, drop all efforts at censorship, coercion, or professional reprisal. Allow your professionals now to pick up the pieces of the pandemic response debacle and help Brazilians heal. Let the country get back on track. The government needs to support doctors, nurses, other healthcare providers in completely free and unfettered information exchange. It's the only way. There is no such thing in clinical medicine as misinformation or disinformation. It doesn't exist. There's simply scientific data and multiple points of view. There's no dyad of science or anti-science. Science is a process, and we follow the scientific method. Anybody using the terms misinformation, disinformation, anti-science, those are weaponized terms. They indicate propaganda. We cannot allow propaganda to creep its way into Western civilization. It's divisive. It's a tool used by those attempting to control others. We should reject the entire term conspiracy theory. There's no such thing as a conspiracy theory. There's simply rational theory and multiple points of view, and we need to discuss it. We need to have more and more discussion about these points of tremendous interest and potential contention in our societies. It's the only way to move forward. So join me in dropping all mandates, all efforts at censorship, pressure, coercion, and reprisal. Drop the COVID-19 vaccines from clinical use. They're not safe for clinical use. Both the World Council for Health and the Association of American Physicians and Surgeons are strongly calling for the vaccines to be removed from the market. Let Brazil show the way and remove this menace from Brazilian society so no other person will take on more genetic material and suffer harm. And then turn all of your attention to those who've been damaged both by SARS-CoV-2 infection and the vaccines. Help us innovate and provide treatment centers to help people recover from the pandemic. 2 waves of injury, both SARS-CoV-2 infection and COVID-19 vaccination. And now it's time to innovate with completely unfettered medical communication. We need full support for federal and foundation-funded research for long COVID as well as vaccine injury syndromes. And together, we can bring a close to the crisis, help Brazil lead the Southern Hemisphere in coming out of the pandemic years, even stronger, more cohesive than it ever was before. I'm Dr. Peter McCullough. Thank you so much for listening to this message.